Hi, my name is Dr. Dhaval Belvi. I am practicing obstetrician and gynecologist in Bombay. And I decided to come for this colposcopy course because I had obviously Madam is a very reputed name in colposcopy, and we have all heard and seen her at various on various podiums. But since I was and colposcopy is a branch that is not does not have the kind of recognition or the kind of penetration in our patient population as much as it needs to be. That is what gave me the interest. And preventive oncology is something that as healthcare providers, we need to be addressing on an aggressive basis. And Madam probably was the only name that came up whenever and wherever we looked for any kind of colposcopic management or advances in colposcopy. So, as far as the teaching year goes, we have spent 5 days, and I would say that the way Madam has handheld us and the way Madam has taught us in the past 5 days has completely changed our outlook towards colposcopy as a subject, and even the way we look at a cervix. So before going into colposcopy, just the way of looking at a cervix and how and what we need to look into, and how colposcopy actually changes our way of looking at it and picking up the small lesions that are will be missed on a normal speculum examination. But with the help of colposcopy and Madam's teaching, we have picked up and we have learned how to pick up so many small lesions and given patients a better quality of life and picked up pre-malignant lesions. As far as the teaching goes, Madam's level of energy, enthusiasm, and dedication and towards the course is tremendous. She gives her heart and soul into it. There is no, I wouldn't say that even once I felt that Madam, we were not able to understand what was being taught. Till the time we were not able to understand a point or get our hands set on a certain point, Madam would not stop in teaching us again and again the same thing. And as far as the hands holding goes, I can say that there was literal hands holding, especially when we were doing the procedures. She was literally physically holding our hand and teaching us the procedures on the mannequins and even on the patient. So there is hands-on on the patients also and on mannequin and on the dry lab specimens also. And as if somebody is even remotely interested in preventive oncology and colposcopy, I will definitely suggest Madam's 5 day hybrid fellowship course. It will totally change the way you look at colposcopy and the way you look at preventive oncology, and it will give you a totally new dimension to your practice.
Okay, so this is Dr. Apsara Fatima, and I'm working as a consultant from Calicut. And so I've taken this fellowship course, hybrid advanced training course by Dr. Priya ma'am, and it's one of the great decisions what I've ever made in my life because. Though I have been already exposed to colposcopy back in my college in PSG, but the nuances and the intricacies of it madam has so beautifully put forth, and definitely the colposcopy looks like a simple subject, but there's so much lot more to it, and definitely it is being taken up as a basic screening tool. There are so much things which could go amiss if we aren't paying much attention to, so that has been very beautifully dealt. The cases, very beautiful cases were being discussed, and yeah, we did receive good hands-on in patients, and we did get a chance to see thermal ablation performed. That there was a dry lab in which thermal ablation techniques we were trained on, and even the intricacies of the leap as well as the LEDs procedures was very beautifully told to us, and literally it was a hand-holding experience. And the beauty of this course is that it doesn't just stop with that 5 days. It just goes on. It goes on. It's much more to that. And I must just say in one word is meeting an icon such as Priya madam has been truly a blessing in my life, and it is a very humbling experience after seeing uh, the caliber of the knowledge which was shared, I must say that I'm truly humbled. I just hope to carry forth whatever she has given to me, and I hope to put it to a great use. And definitely, I would recommend this course to anybody who's looking for. Uh, and wants to have a good grasp onto the subject of colposcopy.
So I'm Dr. Shifa Khan. I'm practicing in Kurla, Mumbai since the past 15 years. I had come for the course because I wanted some insight about colposcopy and to manage uh, pre-cancer lesions and screenings to be done. The madam was very good. Her knowledge, she has very good knowledge about the topic, and she gives the knowledge completely. She imparts it completely. So it was a very enriching experience because you get to learn the basics, and it's not just the procedure. She teaches with a lot of passion. So it was very interesting to come here. The 5 days were a extremely good learning experience. I would recommend this to everyone to go for this course. The instruments also, every instrument part was shown to us, including the colposcope, the instruments which are used. There are some instruments which Madam has designed, like the Teflon coated pinaculum, and the biopsy forceps was very good, which she taught us. And she taught us certain procedures as well, and the procedures also were a very good experience to understand the procedures. There was a lot of hands-on also given to us. So overall, it was a extremely good experience.
Hello, I'm Dr. Vinisha Abhale. I'm a practicing gynecologist from Mumbai, and I have recently just completed the course conducted by Dr. Priya for colposcopy training, and it has been immensely helpful to me. I'm sure that there is a lot of information which we were missing on, and there was a lot to learn. And this is really, really going to be very beneficial during my practice in the service of the patients. I think this has enriched my treatment, and I will, like really be able to do justice to the patients now. Because until now, there was no such training with that I came across in this field, where Madam has been teaching in a very exhaustive, in depth, and her commitment to her passion for teaching just reflects in the way she's brought this entire course. We can feel that she's a very passionate about the subject, and her it makes all the more a lot of difference to whatever she's teaching us. Secondly, not only that the information which we are learning here, but also that she's made it very easy for us, because she has devised instruments specifically which are not available otherwise to be used in colposcopy, and also the tests which were not available, which are not easily available. Also, she has taught us which tests should be done, and she has made those tests available now. I think this is not only a service to not only to all the gynecologists that she's educating for better patient management, but it is also a service for the entire community, for towards for a social cause, if you go to see. So I'm really very glad I did it, and I would encourage all gynecologists to do this, to learn from her. Thank you.